So this is an introduction to peanut balls. I am now a retired midwife, so forgot to update that first screen. And I am an authorised peanut ball trainer here and I sort of cover the UK, including Northern Ireland and Ireland as well. I have had my course approved by Doula UK also. So, and then why I feel as it that I'm qualified to really teach peanut balls is was a midwife, so I still class myself as a midwife. I've still got that knowledge. I'm an authorised peanut ball trainer, as I mentioned, with Premier Birth Tools. They're based in the US. I have an award in education and training to teach adult people. So I've got that qualification I started it last year because it's now becoming a requirement for many trusts that I teach in. So I've got that certificate. I'll never get those 6 months back of my life. Yeah, I've now got that. Adult first aid training, because when I do my courses, obviously you can have accidents and incidents that might happen. So I am first aid trained. I'm also spinning babies. I've done their training, both basic and advanced, and keep in touch with them for any new research that's coming out, new initiatives that they might have. Here in the UK, we've got Optimal Birth with Molly O'Brien for biomechanics training. I've done her courses and keep up to date with her too. And also I have a qualification in myofascia as well, which comes into play with when we're using peanut balls. So peanut balls, what I'll be discussing this evening. So what are they? Why is it important to offer a peanut ball? How can they help in labour? Is there any evidence-based research? Any side effects with an epidural? And do I need training? So first of all, what are they? So they are predominantly used in physiotherapy. So if you're working in a hospital, your physio department may have already some peanut balls that they use for people, particularly children with mobility issues. And a bit like the birth ball, we took that over from the gym and we made use and could see how it could really benefit people when they were pregnant. So we have now taken over peanut balls. And since the 1980s, they have slowly been introduced into the United States for assisting labour. How to look after the peanut balls, cleaning them, storage and temperature is really important. And that is all taught on my course. So that when a trust buy or a doula buys the peanut balls, they know how to look after them so that they last a long time. So they can last greater than 3 years. Where to buy the hospital grade peanut balls here in the UK. So I use a company called Sensory Direct that have all the different size peanut balls. I'm going to share with you why there are 4 sizes. And the reason for that is everybody is different. Everybody comes in different shapes and sizes. So the small yellow peanut ball is for people who are 5'3" and under. The orange ball is for those who are 5'4" to 5'7". The green peanut ball is used for those who are 5'7" and above. And the largest ball, the blue ball, 70 centimetres, and that's the only one for sitting on. All the others are used for leaning on and for placing between the legs. So the other consideration we need to have around sizes of peanut balls is if somebody is 5'6", but they've got short legs and a long torso, or a long torso, no, long legs and a short torso. So those are the considerants that are all part of my training as well. So we need to make sure that we give the appropriate size peanut ball or peanut balls to somebody for their size. And I also cover safety and contraindications of using them, because there are some. And safety is all around making sure that they are safe to use them, because we don't want any accidents happening that involve health and safety coming in and getting rid of our inflatable peanut balls and birth balls, which has happened in some hospitals when somebody has come off them. So these are hospital grade peanut balls, and I'll talk about that more as we go on. So why is it important to offer a peanut ball? So it's to offer a first step before intervention. So this is, you may be looking after somebody and the labour is going really well, and then you're thinking it's beginning to slow down, or her contractions are becoming more spaced out. And you know that if you mention that to your matron, that intervention might follow. So what I tell everybody who does my courses, and when I'm teaching in hospitals at universities, is to think about using the peanut ball before intervention. So more recently, obstetricians are now asking that midwives be trained before using the peanut ball. So there have been incidents where obstetricians have been looking into a birth, perhaps during their meetings, and realised that the intervention happened because or as a peanut ball was used before, prior to intervention. So they're now wondering whether the midwives using that peanut ball know exactly how to use them correctly. So they are now asking that midwives get trained before. And some obstetricians have noticed that those midwives that have done some training, they are seeing less intervention because of the peanut balls. So again, really wanting all the midwives in intrapartum care to have some training, some sort of training in peanut balls, so that they're using them really effectively. It's also, for those that we support, it's to offer more movement options, particularly for those who are confined to a bed, like those with an epidural, which may prevent further intervention. So there is a lot of research around epidural and peanut ball, and all very good. So the research that's coming out is very, very good. I'll share some with you in a moment. To offer more movement options that are comfortable and help reduce severe perineal trauma. So initially, a lot of the research that was coming out was only for those with an epidural. And more recently, they are looking into the other good things that are happening, not just with those with an epidural. And one of the things they've noticed is that less severe perineal trauma has been seen as well as there is a recent piece of research on APGAR scores. So the APGAR scores for those who were in the intervention part of the group for the research actually saw that their APGAR scores were greater than those who didn't use the peanut ball. So lots and lots of research has been coming out this year, which is really exciting. How can they help in labour? So firstly, the peanut ball can help relieve back pain during labour. Secondly, using a peanut ball increases pelvic flexibility, giving more space for the baby to rotate and descend. And additionally, the peanut ball promotes better blood flow during labour to the pelvis area. Furthermore, the peanut ball can assist in the descent and rotation of the baby. Increased maternal satisfaction has been noted, and using a peanut ball can reduce both the first and second stages of labour by 1 hour and 53 minutes. That's one piece of research that I've seen, and I'm seeing others. That's like one of them. So, but a lot of them are saying that they've seen a decrease in first stage and second stage of labour. And a decrease in caesarean births by 13%. So where I am in Bristol, our caesarean rates have increased hugely, particularly our category 3, as people are choosing not to be induced and going straight for section. So it would be fantastic to get that 50% instead of it continually to grow, is to basically knock it on his head and use the peanut ball to try and reduce our cesarean rate. So some of the research, so this was the first major one. And as you can appreciate with research, it does cost a lot of money to run a research. So, you're all right if you're researching some drug because they've got loads of money, the drug companies, but it's harder. So I've got 32 really good research papers that are in a folder that I take with me whenever I do my training for people to look at. I've also got a list if anybody's interested in having a copy of that list to help see whether they can get training in their hospital or university. So I'm happy to share that with you. So this one was by Tussie et al. In 2015, reducing length of labour and caesarean surgery rate using a peanut ball for women labouring with an epidural. So their finding was an RCT of 198 women receiving an epidural with babies in a vertex position. Women who used the peanut ball demonstrated a shorter first stage of labour by 90 minutes than those who did not. Women who used the peanut ball demonstrated a shorter second stage of labour by 23 minutes than those that did not. And the peanut ball use was associated with significantly lower incidence of caesarean section, so decreased the caesarean section rate by 13%. They concluded that the peanut ball is a successful midwifery aid, supports physiological birth, and helps the progress of labour. What was interesting about this piece of research when I read through it was that they only used one peanut ball position. And the peanut ball position that they used, I don't rate very much. I think there are many better ones so it'd be interesting to do a research paper using more than one position. So there are some that are showing better than this, and this is pretty good. The next one is from 2022, so affected the peanut ball on the progress of labour and birth. So there were 768 were randomised into two groups. The results showed that there was a significant difference between the two groups: duration, interval of contractions, cervical dilatations, fetal descent after the intervention, including a highly significant shorter duration of labour of first and second stages of labour among the study group than the control group. In addition, 95% of the study group had a vaginal birth and 75% of the control group. Their recommendations were for labouring women to use a peanut ball, especially those who are confined to a bed during childbirth. They also mentioned that the World Health Organization recommends that the peanut ball may be a helpful tool for achieving frequent position changes without disrupting labour procedures. So that was in 2022. And then there's this one that I sought this week, so I found it. So the effectiveness of positional program involving pelvic biomechanics using a peanut ball during labour on maternal and neonatal outcomes. So again, a randomised control trial. And the results were the use of the peanut ball during labour reduced labour time by 188.2 minutes. Mustn't forget that 0.2. Increased the probability of a vaginal delivery by 73% and decreased the risk of a caesarean delivery by 60%, and significantly reduced maternal fatigue and anxiety as well. So those are the research papers. Like I say, I've got 32. So anybody who wants one, just put that in the chat, and then I can pick that up afterwards and send you that. Peanut ball, so no side effects seen with an epidural. So no decrease in the level of the epidural either. Does not get too heavy on one side. Making sure to turn to the other side after 20-25 minutes. So here you can see a lady and she's just lying on her side in bed. So after about 20-25 minutes max, you would then help her and support her to roll onto the other side. Or if she wants to roll over sooner than that, then that's fine. And she's got the peanut ball between her knees to help open the pelvis based on where her baby is. So we need to think about women with an epidural to protect joint strain by always respecting the limits of their joints. We don't want to strain, jerk or twist their trunks or limbs. And we support numb limbs when assisting with positional changes. So if they've got a particularly heavy epidural, heavy block, then we just need to think about, because they're not going to feel any twist or torque that we're putting that pressure on that hip. So yeah. So the scenarios could be labour dystocia or stalled labour, so caused by a high head, not yet in the pelvis. We got positions to get that head further in. Pressures from the labour ward when labour begins to slow down at 6 to 7 centimetres. They might be, the matron might be thinking we need to get syntocin on drip up. So again, before any intervention, we should think peanut balls. For abdominal labour, occiput posterior positions, it's fantastic for asynclitic head or malpositions like breech. I've used it for people with breech. Those obviously with an epidural, and there are some really good pushing positions as well. Do I need training to use them? I'd say no. However, I do feel that you're not fully optimizing the possibilities for a vaginal birth. Understanding the physiology of why certain positions can help will enhance your skills and may shorten labour for those you support. Being able to cite evidence-based research is essential when offering peanut ball positions. And health and safety, understanding when offering a peanut ball is contraindicated is key. So not just using them. So I went to a hospital, and when I got there, they looked at my 70 centimetre, the largest peanut ball, and they said that's the only size that they have. And the women found it very uncomfortable when placed between the legs. And I'm not surprised, because that is the one you should only use for sitting on. It's not to be placed between the legs. So they had, without knowledge, they had gone and bought the wrong peanut ball and only got one size. And of course, they didn't use them. So they got me in to take, and then they realised there was other peanut balls. So I've had some lovely testimonials. I go to quite a lot of universities and heading off to one in January. So I keep meaning to message you. I'm first year student midwife and recently purchased your peanut ball course. I supported a woman on delivery suite a few weeks ago and got an amazing outcome for my lady and feedback from my supervisor. Your course has been so great, and having the slides to glance over has been so helpful. I cannot recommend you enough to my colleagues. I just wanted to share this with you, as what I learned has honestly been a game changer, and I'm so excited to continue using my skills to help even more women. And then the little one is from her supervisor. I worked with Katie on labour ward, and she really impressed me with the knowledge and skills she has already. We use Kate's newly acquired knowledge of peanut ball positions, helping a woman with an epidural, long labour and OP presentation, successfully rotating the baby to OA, and as a consequence, facilitating a beautiful vaginal birth. Kate built up a brilliant rapport with the families we cared for that day and was very grateful for her care. So some more, so it's definitely made me reflect on the times I've used a peanut ball in practice, and it's most likely wouldn't have helped and possibly hindered in some cases. But hindsight is 2020 and knowledge is power. So I will absolutely take the information I've learned forward and use it in practice in my final placement as a newly qualified midwife and beyond. I can't wait to share about the course to everyone I see on practice, and will 100% be recommending everyone to do it. But mostly, I cannot wait to use what I've learned to hopefully improve the outcomes and experiences of those within my care. I really enjoyed this course and think it would be so beneficial for students and qualified midwives to attend. Research is resounding that when used properly can reduce intervention rates. So what's not to love about that? Another one, this course is absolutely essential for student midwives and midwives who support women in labour. I learned so much and feel I can now completely use peanut balls to support women because I understand what positions to use in different situations and more importantly, why. Wendy is a lovely and really engaging, would 100% recommend. And finally, I really enjoyed the day with Wendy, learning about all things peanut balls, and I cannot wait to take what I've learned into practice. So those are some from students that I've taught. So what I am offering, so my course is an access to my e-learning peanut ball online course. It's a learning and management system. No expiry date and includes lots of information and videos, including storage, sizing and caring for the peanut balls, where to buy the peanut balls in the UK. They have to be hospital grade, burst resistant and latex free, and you can purchase them from Sensory Direct. Videos for inlet, mid-pelvis and outlet, both basic and advanced positions. Videos for pushing, positions for breech, asymmetrical positions, and positions for those with an epidural. You will also receive a set of PDF slides or posters if you are teaching antenatal classes, access to a WhatsApp group for training and trained birth workers, ongoing access to the Peanut Ball e-learning online course because I do update it, guidelines for hospitals to use it so it goes through your ratification, but you can have a copy of that guideline rather than writing your own, and on completion the option to offer Peanut Ball courses in your antenatal classes. So all the classes include a quiz at the end of the online course, which you must achieve 80% to move on to the assessment. The assessment is a video of you with a colleague client demonstrating two positions for the inlet, mid-pelvis and outlet, explaining why you chose these positions and what considerations you made for your choice. You send me the video and I will assess, provide feedback if needed, and when you pass, I will send you a certificate of completion. So that's what everybody gets. And then my offerings are, so an e-learning learning management peanut ball course. So this is just priced at £45. I will be talking about an offer that I'm offering on this price. Group price is also available. So if you are a doula and you know quite a few doulas in your area and you would like a better price than 45, just get in touch. Depending on how many other doulas and birth workers you have, then I can give you a good price. So you can do it in the comfort of your own home and in your own time. The course includes the following: a multiple choice test, the option to do the assessment, a set of peanut ball slides emailed after successful completion of the quiz, and a certificate worth 5 CPD points. It takes roughly 5 hours to go through the learning management e-learning course. Then live Zoom training course. Oh, ignore that date, sorry, that was my last one. So the price is £60 per person. And it's maximum groups of 12. Don't worry if you don't have a peanut ball. I show you how to make an alternative for that session. Access to the e-learning learning management system training course that you must complete before the live Zoom. Completing your assessment, you get 6 points because it's 3 hours in the morning, 3 hours in the afternoon. You'll get your certificate. Increased interaction with other people, and again peanut ball guidelines included for midwives at hospitals. And then the most popular one I do is my in-person peanut ball training for birth workers. So it's an in-person practical training day. So price on applications for hospital, universities, doula groups in the UK and Ireland. Groups of a minimum of 15 to a maximum of 25. Access to the e-learning peanut ball LMS training course. You undertake your assessment as part of the practical training day. You get 7 CPD points and a certificate of attendance once you've shared with me your assessment. It's increased interaction. It's loads of fun. It's very full on. I bring all the peanut balls. So if I've got 25 people, I tend to have 5 groups and there's 4 peanut balls. So over 20 peanut balls I tend to bring with me. And you also, if you're a hospital, get the peanut ball guidelines included. So there is cascade training. So this is an exclusive training opportunity only available to maternity hospitals where the midwife or midwives have participated in my in-person peanut ball training day. Details will be shared via email. If this is of interest, let me know. So you need to have your book your in-person and then you can offer cascade training going forward. So there, that is me. So thank you. My email address is peanutballtraininguk@gmail.com. My phone number is 07940 885 436. And my website, as mentioned, wendyproctor.org.uk. So I'm going to stop share.